If you're exploring non-invasive options for chronic pain, arthritis, or stiffness, you may be wondering whether EMTT, which is extracorporeal magnetotransduction therapy, is right for you. EMTT has been growing rapidly across the U.S., especially among adults searching for natural healing solutions that help them to avoid medications, injections, and surgery. But how do you know if you're a good candidate for EMTT? Well, that's exactly what this video will address. Hello, my name is Dr. Beth Templin, and I am the CEO and founder of HouseFit. As a leading provider of EMTT in St. Louis, we've helped many adults, especially those 50 plus, regain strength, mobility, and confidence through this gentle yet powerful therapy. EMTT is not just another tool for pain relief. It's a regenerative treatment that supports your body's ability to heal at the cellular level. Let's take a closer look at people who benefit most and the conditions that respond best and the signs that EMTT may be the treatment that you're searching for. First, what makes someone a good candidate? In the simplest terms, you're a good candidate for EMTT if you have pain, inflammation, or stiffness that hasn't improved with traditional treatments. EMTT works best for people who are experiencing chronic issues, things that have lingered for months or years because the tissue simply hasn't healed properly. You may be a great fit if you want to avoid surgery, want to reduce or eliminate medications, haven't improved with traditional physical therapy, have an injury that keeps coming back again and again, have arthritis that is limiting your movement, and want a safe, natural, regeneration-based option, someone who prefers a non-invasive treatment with no downtime, and if you're over 50 and notice healing is just slower than it used to be, this might be perfect for you. Let's break down the most common situations where EMTT makes a powerful difference. The first is adults over 50 who want to stay active without pain. This group represents some of our most successful EMTT outcomes. As we age, our cellular metabolism slows down. Tendons stiffen, joints become more irritated, cartilage thins, and inflammation becomes more chronic. As a result, healing takes longer, injuries linger, and daily activities begin to feel harder. This is exactly where EMTT shines. EMTT helps aging adults by reducing chronic inflammation, improving joint comfort, restoring mobility, energizing sluggish cells, supporting tissue regeneration, and helping to avoid injections or surgery. Clients in their 50s, 60s, 70s, and even their 80s report feeling looser, more mobile, more confident walking, better able to exercise, and less stiff in the mornings. If aging is slowing your healing, EMTT helps to turn the lights back on at the cellular level. Second, people with arthritis. This can be in the knee, hip, back, shoulder, hand, pretty much anywhere. Arthritis is one of the most common reasons people will seek out EMTT. And why? Because arthritis isn't just wear and tear, it's a biological process involving inflammation, reduced circulation, and cellular dysfunction. Medications can help the symptoms, but they cannot restore proper cellular function. EMTT targets the root cause of arthritic pain by reducing inflammation around the joint, improving joint lubrication, enhancing mobility, supporting healthier cartilage and tissue, and decreasing stiffness. We are seeing exceptional results in knee arthritis, hip arthritis, shoulder arthritis, spinal facet joint arthritis, thumb and wrist arthritis, as well as hand arthritis. Clients will often report easier walking, less pain going up and down the stairs, better ability to get out of chairs, more confidence in using their hands, and if arthritis is affecting your life, EMTT may be one of the best non-invasive tools available. 3, people with chronic tendon or ligament pain. So tendon injuries are notoriously slow to heal, especially once they become chronic. So EMTT is uniquely effective because it stimulates tissue repair from the inside out. Common tendon conditions that respond really well are Achilles tendinopathy, plantar fascia irritation, patellar tendon pain, rotator cuff issues, biceps tendonitis, hip and gluteal tendinopathies, tennis elbow or golfer's elbow, hamstring insertion pain. Most people have already tried rest, stretching, massage, or even steroid injections with little lasting improvement. EMTT can help regenerate and re-energize the tendon, creating a real pathway towards recovery. 4. People with back pain, SI joint pain, or deep spinal inflammation. So because EMTT penetrates up to 7 inches deep, it reaches structures that many other therapies cannot touch. This is what makes it ideal for chronic low back pain, SI joint irritation, lumbar set inflammation, degenerative disc discomfort, and deep spinal muscle tension. People dealing with long-term back issues often say that EMTT gives them a lightness in their lower back, less stiffness first thing in the morning. They feel more comfortable walking and have a better ability to stand for long periods of time. So if your low back problems flare up repeatedly, EMTT can help to break that cycle. 5 is for people who want to recover from an injury who really just want to heal faster. So whether you have a sprain, a strain, a repetitive use injury, a sports-related irritation, EMTT helps to accelerate the healing without adding additional stress to the tissue. It's especially effective when injuries are persistent, slow to heal, easily aggravated, linked to inflammation. EMTT provides deep, soothing support that helps the body to repair itself more efficiently. 6. People who want to avoid or delay surgery. So many adults in St. Louis come to us after a surgeon has recommended a knee replacement, hip surgery, rotator cuff tears, tendon debridement, or arthroscopies to just go in there and clean it out. And while some of these surgeries are truly necessary, many cases can be improved significantly and sometimes completely through regenerative therapy. So EMTT helps people to avoid surgery by reducing inflammation around the joint, supporting healthier tissue, improving movement quality, and enhancing strength and function, especially when paired with physical therapy. So helping people to return to activity without a major intervention, it's one of the most safest and effective alternatives for people who want to explore every non-surgical option first. 7. People who don't want injections or can't tolerate them. So steroid injections carry risks, including tendon thinning, cartilage breakdown, weakened connective tissue, and they often only give temporary results. Other injections like PRP or hyaluronic acid are expensive and can be very uncomfortable. EMTT offers an alternative that requires no needles, is painless, has no downtime, supports long-term healing, and is perfect for those who want regenerative benefits without invasive procedures. 8. People who have failed previous physical therapy but still want to improve. So physical therapy is essential for long-term strength and independence, but sometimes painful or highly inflamed tissues, they simply can't tolerate exercise or they fail to respond well. This is where EMTT becomes incredibly valuable. EMTT helps by reducing the inflammation that blocks progress, calming irritated tissues, improving mobility, and preparing the body for exercise. It actually makes physical therapy more effective, and when you combine EMTT plus physical therapy, we often see dramatic improvements over either therapy alone. So, who's not a good candidate for EMTT? While EMTT is extremely safe, some people are not candidates. You should avoid EMTT if you have a pacemaker or active implanted electrical device, if you are pregnant, if you have a tumor or active cancer in the treatment region, if you have an infection in the treatment area, or if you have certain neurological disorders, and we evaluate those case by case. We always perform a thorough screening prior to your treatment to ensure it's safe for you. So, how we determine whether you're a good candidate? Well, at HouseFit, your evaluation includes a detailed movement and strength assessment so we can identify the dysfunction contributing to your pain, a tissue irritability and mobility exam to understand whether EMTT will target the root problem, a complete medical screening to ensure safety and appropriateness, and a conversation about your goals. Is it to move better with walking, stairs, to travel, to get on the floor, to play pickleball? And then we give you a personalized regenerative plan. This often includes EMTT and potentially shockwave and physical therapy as well. You are never placed into a one-size-fits-all protocol. Your treatment plan is unique, just like you. The bottom line, if pain or stiffness is limiting your life, EMTT may be the answer. Here is the simplest way to know if you're a good candidate. So if you're tired of being limited by pain, if you want a natural, non-invasive healing option, if you haven't improved with traditional treatments, if you want to stay active, strong, and independent, if you're looking to avoid surgery or injections, EMTT gives aging adults a powerful way to heal and not just to cope. So if you're ready to see if EMTT is right for you, we'd love to help. At HouseFit, we offer a free one-on-one consultation, customized regenerative therapy treatment plans, and a supportive team specializing in holistic healthy aging. If you're ready to move better, feel better, and live fully, you're in the right place.